Sorry.
Progress.
Some of you may know me and some of you don't, but my name is Latoya. I am a lot of things, but I'm a birth worker. So I'm a doula, a birth doula, postpartum doula. So I help women have babies, take care of them after they have had their babies. So I'm also a personal trainer, so into health and fitness as well. So you're going to see kind of how all of this is kind of bringing us to this conversation. All of my, I guess, the educational things that I do for my community. So I'm very excited to have you here. Let me get the presentation up and we'll just go ahead and get started. So I will be sharing this presentation in the chat, and the resources and solutions that we talk about. Also, I have a handout that I'll be sharing. But our topic for today is vasectomies, tubal ligations, and hysterectomies. And a little bit about my past. My grandmother was on my father's side was a birth worker, and so she was what we would call now a granny midwife or a doula, postpartum doula. And then on the other side, my maternal grandmother, I lost in the birthing space. She hemorrhaged after having my uncle. She needed 4 pints of blood, but hospital policy was only 3 pints of blood, and so they follow hospital policy, and I lost my grandmother. So birth work is very important to me. Us making very informed decisions. I feel like I want y'all to see me when I talk about this. Us making informed decisions is very important to me. So this is why we'll have this conversation. We're having this conversation because at the end of the day, if we discuss everything that is involved with these procedures and you feel like it's worth it to you, then fine, go ahead. But that is your choice. But you need to be able to make that choice with the all of the information. So when it comes to vasectomies and tubal ligations, it kind of started with me being out in the community and having questions when people had certain situations going on. So, for example, if I had a woman who told me that she had a hysterectomy, my first question to her would be, "Did you have your tubes tied?" And 90% out of the time, the answer was yes. And so it made me question why, and it made me want to research it a little bit more. And kind of the same thing with vasectomies. I had several people that I heard kind of going through the same things. And it's just like, what is it with vasectomies and what these men are going through? And so it makes me want to do the research. So that's what I will be sharing with you today. Just wanted to kind of let you know how we got here. All right. So, word on the street, anytime we have any kind of procedures that we want to have done, of course, we want to maybe look at the pros and the cons. And so I've kind of been asking people what they've heard about vasectomies, tubal ligations, hysterectomies, personal experiences, and it's a wide range of things. And I definitely think it depends on when people have their procedures done. And you'll see that in the studies as well. So the first thing we're going to talk about is a vasectomy. So I did promise the men I would get that out the way first. So if they wanted to stop, they could stop after that. But let's first talk about what Planned Parenthood say about a vasectomy. They say that it is effective, it's convenient, it's a permanent form of birth control. It takes the stress of preventing pregnancy off of your partner and can even make your sex life better. So Planned Parenthood is very concerned about your sex life. And so when I share this, I do have a video that actually shows the procedure that's linked right there. But let's talk about the risk that's listed from Planned Parenthood. So they said that they are permanent. Most common risk with the vasectomy is infection. So that's the most common risk is infection. But those are usually minor and treatable with antibiotics. They say you may also have some pain, bleeding, bruising, or swelling after the procedure. So even though it's not a risk, vasectomies don't prevent STDs. So they're saying more people will probably have unprotected sex, which will lead to STDs, and then also vasectomies are extremely safe for most people. So this is what Planned Parenthood has to say about vasectomies. But when I kind of did the research, I saw this number of 60%. And I'm like, 60%. Okay, so 60%, oh, that's the diagnosis of, I'm sorry, overall, the rate of this diagnosis is about 60% higher among men who have been sterilized. So the question is, what is this diagnosis? I had posted it on Facebook and Instagram, and a lot of people got it right. It was prostate cancer. And I think 60% is a very, very big number. So, there were two large studies done at Harvard, and this is all the way back in 1993. So this is not new information, but it says that men who had undergone a vasectomy more than 20 years earlier were almost twice as likely as their unsterilized counterparts to have been diagnosed with prostate cancer. And I think this is very important because, as I said in one of my videos, when our family members are going through things like this, it involves the whole family. So, and even outside of your home. So, it is important for us to understand you're going to twice as likely have this diagnosis. So, in the Journal of the National Cancer Institute, so this was in 2020. It says that a man's increased risk of prostate cancer has been linked to his prior reproductive history with low sperm quality, low ejaculation frequency, and a low number of offspring. So they did consider things like BMI, smoking, other cancer diagnosis, socioeconomic statuses, and these things could all be excluded as connections. Um, but the results, let's talk about the results. Men with a vasectomy had an increased risk of prostate cancer compared to no vasectomy. The increased rate of prostate cancer following vasectomy persisted for at least 30 years after the procedure. So you have to be like on notice for 30, at least 30 years. Was observed regardless of the age of the vasectomy, at the vasectomy, and cancer stage 8 diagnosis. Adjustment for the number of visits to the doctor and socioeconomic factors did not explain this association. So they were really, this study was very, very, very in depth. And I have the resources list included in this presentation. This is a very in depth study, and they were able to exclude a lot of things being a factor as to why these men were having these numbers. So the conclusion, and this was a 38-year nationwide study. Vasectomy is associated with a statistically significantly increased long-term risk of prostate cancer. It can manifest itself from 10 years after the procedure. So when we have women saying, of course, they don't want to get their tubes tied and opting for their men to do this, we need to understand what we're actually doing, because especially if you're a man provider, because you're putting him at risk for, these situations. And I know that some people have already done these things, and we're going to talk about what you can kind of do. So it says that our finding has important global public health implications because prostate cancer is the most common male cancer, and vasectomy is a widespread form of contraceptive. So if we put two and two together, it just sounds like we might need to come up with a better solution if this is what's leading to that. We estimate that one man will develop prostate cancer because of a vasectomy for every 71 men vasectomized. That's to me, that's a really big number. The facts, here are some signs of prostate cancer: pain or burning sensation during urination, frequent urination, a decrease in the size and force of urine flow, an inability to urinate, blood in the urine, and continuing lower back or pelvic discomfort. The rate of prostate cancer is rapidly rising in all men, even those under the age of 50. In younger men, it increased possibly due to the diet and exposure to environmental toxins. So we definitely have to look at external factors as well. Heavy fat consumption raises testosterone levels, which could stimulate growth of the prostate. It is so important to have a well balanced diet. I hear so many women talk about how their men cannot live without meat, but it's so important to have a well balanced diet that includes fruits, vegetables, grains, nuts, all colorful vegetables, everything. So, prostate health blends, you can. So the solution, if you already had this done, procedure done, what you definitely need to do is make sure you're taking care of your body. You need to make sure you're feeding your prostate the proper supplements and herbs, vitamins, and nutrition that it needs. You can definitely be proactive about the situation, and we're going to see that. So they do already have blends that's already together that you could purchase. So you can get you a prostate blend to support your prostate. Dandelion and red clover are good for cleansing the liver and the blood. It's very important to maintain a whole foods diet. Eat plenty of whole grains, nuts, seeds, oats, broccoli, cabbage, cauliflower, yellow and orange vegetables. Consume freshly made vegetable and fruit juice daily, especially if you are in the situation of having that diagnosis already. Include foods that are high in zinc, such as mushrooms, pumpkin seeds, seafood, spinach, sunflower seeds, and whole grains. Zinc nourishes the prostate gland and is vital for proper immune function. It is so important to restrict your intake of dairy products. I know what we've kind of been told by our society. I know that we've what we've been told since we've been in school, but dairy definitely has a negative effect on our bodies. And it does not do what we think it does. It's not the best way to get what they say it does. Um, do not eat red meat. If you have this diagnosis, you need to definitely not eat red meat. If you don't have this diagnosis, you need to lessen your red meat. There is a definite correlation between high red meat consumption, 5 or more servings a week, and the development of prostate cancer. So that link is there. So you definitely need to either limit your consumption of red meat if you've had this procedure done already. If you have a diagnosis, you don't need to eat red meat at all. Strictly avoid the following foods: junk foods, processed refined foods, salt, saturated fat, sugar, white flour. Of course, all the things we know already. Um, Also, part of the solution: watchful waiting with nutritional support and lifestyle changes is becoming the preferred approach to this cancer if it's caught in early stage. Many consider prostate cancer to be one of the most overtreated diseases in America. Physicians in Europe have long used a conservative approach with comparable results. In 1994, before in the New England Journal of Medicine, a large group of men who refused traditional treatment, surprisingly, they fared just as well and possibly better than men who did not accept medical treatment. So our bodies are resilient. Our bodies will do what it is made to do when we give it what it needs. So it's definitely about feeding it proper nutrition and addressing the issue and getting to the root of the problem. So that's kind of the spiel on vasectomies and the risk if you've already done it, what you need to do. At the end of the day, we definitely need to just take care of our bodies, period. We need to make sure we're consuming fruits, vegetables. It's always good to get freshly pressed juice when possible, especially if you have any kind of diagnosis. But at the end of the day, you don't just have to, take prescriptions or just think that you don't have any options. You definitely need to follow your doctor's orders and, be under doctor's care. But you also need to be proactive and make sure that you're feeding your body what it actually needs to recover, fix, and thrive. So that's the vasectomy spiel. And so we're going to move on to tubal ligations. And I can honestly say that I've been questioning women, like I said, for probably like 20 years now. If anybody for some reason told me they've had a hysterectomy, my first question would be, did you get your tubes tied? And like I said, 90% of the time the answer would be yes. And so now as I'm getting further in my work, it makes me just wonder why. And I knowing my friends and loved ones and hearing things that people have gone through, it's just evident when we look at what the studies and things actually say. Um, can everybody see the slides? Because somebody said that their screen was black. Can you type in one or something? Can you type in one if you can see the slides? If you're following the presentation. Oh, y'all can't see the slides? Oh my goodness. Okay. Let me try again. I wonder why you can't see the slides. So did you just see a black screen? You couldn't even see me? All right, I'm going to try again. Jessica, text me if you can see the slides. So you should see a slide.
I see it now.
Okay. All right. Oh man. I'm sorry y'all didn't see all that. So on to tubal ligations. So tubal is referring to the fallopian tubes, ligation to tie off. And of course, this is a common form of birth control in our society. I know as soon as a woman births a baby, the first question is which one do for birth control? And if she mess around and have more than 2 kids, they might even ask if you're ready to tie your tubes. And so I just really feel like a lot of things are offered so nonchalantly without people really understanding all that is involved. And so let's talk about tube ligations. So on WebMD, some of the pros: surgery to cut off or block your fallopian tubes. When the eggs are released, it can't meet up and be fertilized. So that's why it works. They say it's permanent, it's effective, it doesn't cause the side effects the birth control do, like mood swings, weight gain, headaches, cramping, heavier periods, or spotting. Um, it says that it can lower your chances of ovarian cancer. And some of the cons that they list: that it's permanent, it doesn't protect against STDs, pregnancies, even though they say that it's rare. It may lead to ectopic pregnancies. After tubal ligations, you might have a rapid decline in hormones, your hormones, estrogen and progesterone. Um, yeah. So that was from WebMD. But I do want to point, I want to just go right back, sort of go back to one slide where the pros was one of the pros: doesn't cause the side effects the birth control do, like mood swings, weight gain, headaches, cramping, heavier periods, or spotting. So it said that it does not do those things. That's a pro. And then under the cons, I just want you to pay attention that after it's done, you have a rapid decline of your hormones, estrogen and progesterone. So I think we kind of know what will probably happen when we have that decline. But let's see what Planned Parenthood has to say. They say it's very effective, it's convenient, doesn't change your hormones, it can make your sex life better. The cons, these are the cons that they list: it's permanent, doesn't prevent STDs. Overall, tubal ligation is very safe, and most people don't have any problems. So that's what Planned Parenthood had to say about it. But let's go back to WebMD. When you look that up, you're going to see, when you're looking up tubal ligations, you're going to see them talk about something that's up for debate called post tubal ligation syndrome. Post tubal ligation syndrome. So, based off the name alone, we know that this is something that happens after a tubal ligation. So, some symptoms are a lot like menopause: hot flashes, a dry vagina, trouble sleeping, irregular periods, heavy, painful periods, night sweats, mood swings, and a lower sex drive. Okay. But remember, they're not supposed to cause all of these effects and stuff. Okay. But here we go with hot flashes, dry vaginas, problem sleeping, your periods are messed up. They might even be heavier and painful. But yeah, but you're gonna have a much better sex life. So the syndrome, though, is caused possibly by the blood circulation problems in and around the fallopian tubes and ovaries, pressures on the nerves, and intrapelvic adhesion. But they do say that it's very, very important for you to differentiate between the symptoms that you might be feeling from the syndrome and endometriosis. So you could be possibly getting an endometriosis diagnosis, but what you're really experiencing is the side effects of your tube ligation leading to this post PTLS. They got an PTLS. So also, during diagnosis, it's important to differentiate between functional hemorrhaging due to hormonal abnormality and um, anatomical hemorrhaging due to polyps or tumors. So we talking about hormones once again, something that they said that was not going to. We saw that there's going to be that huge decline of your hormones, and now we're seeing that there is something that that it leads to. But there is more, according to WebMD. Your risk of these type of issues are higher if you're overweight, you've had surgery in the same area before, if you're diabetic, if you have lung disease, pelvic inflammation disease. So if we look at our society, we know that there's a lot of people that can check at least one of these things off the list, if not more than one. And then we add on top of the fact that you have this huge drop in your hormones. So that's going to add to situations too. Up to 20% of women who have tubal ligations eventually wish they hadn't. Women younger than 30 are more likely to change their minds later. So a hysterectomy, what is it? And I want to play this video just because a lot of times I ask women, about their hysterectomy, and a lot of women don't even know what kind of procedure they had. And so it's important for you to know there are different ones.
Hello, I'm Dr. Jessica Hunt. I'm a GYN oncologist or a gynecologic oncologist here at St. Mark's Hospital. One of the questions that I get when I talk with my patients is, what is a hysterectomy? There's a lot of misconceptions about what this is. I have patients say, my friend got a full hysterectomy or a partial hysterectomy. What a hysterectomy is the removal of the uterus and the cervix. When we do a supracervical hysterectomy, that's when we leave the cervix. It's not done very often, and mostly specialized doctors will do that procedure. But a full hysterectomy, a regular hysterectomy, is when you remove the uterus and the cervix. This can be either done with an open approach, a laparoscopic approach, or a robotic approach, and even a vaginal approach where the GYN doctor will remove the uterus through the vagina entirely. If you have a bilateral salpingo-oophorectomy, which is a big word, but that's your tubes and your ovaries, that's additional to the uterus. So a hysterectomy is the uterus, the oophorectomy is the ovaries. So you can have your uterus removed, but have your ovaries remain in place so you don't actually go through menopause. And that's a big distinction and an important distinction to talk to your doctor about when you're deciding whether or not to have your uterus, ovaries, and tubes removed.
Okay, so before we go more into hysterectomies, I just want to see why I want to tell you why we got to hysterectomies. So what what I found was that because of this PTLS and these women going through all of these symptoms, of course they're going to their doctors, telling them how they're feeling. And what did the doctors do? Put them on birth control. That was the whole point of getting your tubes tied, was so that you wouldn't have to take birth control. But then here women are on birth control trying to do what? Regulate their periods. Their periods are so painful now. I know that, like, even when I had my IUD, my cycle was so painful. They were trying to prescribe me narcotics. I'm like, I'm not taking narcotics to take, to have IUD. Take this out. But the point is women start to try to figure out why they're feeling, and they look for solutions in birth control and other things. But at the end of the day, it's this drop in estrogen, progesterone, everything that your body's going through, depending on what kind of tubal ligation. I'm sorry, I'm getting to hysterectomies. I'm getting to hysterectomy. But you'll see that depending on what kind of hysterectomy you have, your body's going to go through some things. But what I was going to say about the tubal ligation is that women's be so tired of doing all of these things with their cycles and the side effects of the birth control, then they say they want a hysterectomy. And so that is why when I ask women who had a hysterectomy, if they had a tube side, most of the time the answer will be yes. And you probably know of women who are having like horrible cycles and have been having or having all of these issues and are saying that that's what they want as a solution. So this is why we need to talk about these things, because if you have had a tubal ligation, then there's things that you need to do to kind of help your body recover from that. So let's kind of go into the next part of the presentation and let me know if you cannot see the slides again. All right, so now I want to kind of talk about the risk of a hysterectomy. So that we just don't take these situations lightly. I know a lot of women that just be like, take it out, but we need to see the long-term effects. So women who were non-users of menopausal hormonal replacement therapy had an increased risk of death if they had undergone a hysterectomy and bilateral ooh before the age of 50 compared to those who had not. And so that is a huge risk. Increased risk of hypertension, obesity. How many people are fighting obesity? And it is literally a fight. Have you had a hysterectomy? Cardiac arrhythmias. I'm sorry, arrhythmias, a coronary artery disease. I'm sorry, artery disease. The risk of congestive heart failure and CAD increased by 4.6-fold and 2.5-fold, respectively, if done older than 35. So we're talking about some pretty heavy risk when it comes to these hysterectomies. You have a risk of stroke. That increases if it was done before the age of 45. Increased risk of CVD, metabolic conditions, or stroke, especially when performed at a younger age. Increased bladder, thyroid, and urinary tract cancer. The highest risk was observed up to 10 years after surgery was performed before the age of 45. So if you had this done before the age of 45, then that risk was increased. There's associated negative impact on your pelvic anatomy and lower urinary tract symptoms such as urinary retention, urinary incontinence, increased urinary frequency and urgency, increases risk of premature menopause, premature ovarian failure, frailty, osteoporosis, or vasculomotor symptoms. It increases your frailty index by 21%. So there's a lot that goes on when when we do these procedures. Of course, you have a decrease in your estrogen secretion, which leads to greater granular bone mineral loss and great risk of osteoporosis. So now let's go to the mental piece of this, of getting hysterectomies. Depressive symptoms were greater with this procedure. Depression risk increased if performed between the ages of 18 and 35. Your risk for bipolar disorder increased. It doesn't increase the overall risk of dementia, but it is an increased relative risk of early onset dementia before 50. It was linked to premature estrogen deficiencies, to which the younger brain may be more vulnerable, which is they say may lead to this early onset of dementia. It doesn't alter your risk for ovarian cancer, so that part that they said was true. But we see that there is a lot of things that it does alter. So if we go back to Planned Parenthood and what they say, like our pros and cons was for, the this the birth control method that could lead to this hysterectomy. They said it was very effective. It was convenient. Doesn't change your hormones and can make a better sex life. Your cons were permanent, doesn't prevent STDs. Overall, tubal ligations are safe, and most people don't have problems. That is definitely not what the studies show. So, what is the answer? If you're considering um, just what you need to do for birth control, you need to definitely attempt to just first regulate your cycle through herbs like Vitex, and they have hormonal blends like already together that you can take to regulate your hormones. If you've ever taken any form of birth control, you need to take Vitex. You need to take something for your hormones. As a birth worker, when I have moms that have a baby, after they have a baby, I recommend them go get a bottle of Vitex and just like go through a round of that to aid in getting their hormonal level back together. So I would say first take some kind of hormonal blend to get your cycle regular, and then you need to track your cycle, chart your cycle. They have apps for that. Some people don't like to use apps. I'm okay with that. I'd rather use an app than to trust myself. But there are options as far as birth control goes. Um, Eat a healthy diet. Eat all the colors of the rainbow when it comes to your food and fruits and vegetables and things like that. I would suggest taking a food grade vitamin. Everybody needs a good multivitamin and supplements. And when you do buy your supplements and vitamins, always use the filters vegan and organic. And that usually takes out most of the garbage and leaves you with the good stuff. Read all the side effects for your medication and know the risk for these procedures. They are not going to tell you what the studies say. They're going to tell you what they're supposed to say. And so you have to do your research. And like I said, if you go through all of the research and it's worth it to you, then fine, cool. But you need to be able to make informed decisions. That's what it's about, making informed decisions. If you have already had these procedures done, it is very important for you to maintain a healthy body weight and have good eating habits. Your body is a machine. It is a well working machine. It will work properly if you give it what it needs. Just like your car is like, if my car doesn't take diesel and I go put diesel in it, my car is going to mess up. That's just like your body. When you put the bad stuff in it, your body is going to respond. But on the flip side, when you put the good stuff in it, your body will respond. And so it will heal itself. It will begin to rejuvenate itself. And just like the studies show in other countries, when they did take a more holistic approach, a comprehensive approach to health, they were able to reduce some of these things. So definitely reduce your dairy and meat intake. Um, it strips your bones of calcium despite of what the people say. So if you're fighting osteoporosis or walking into that, that is definitely not what you need. If you're fighting any kind of diagnosis, that is definitely not what you need. The acid that it takes to break down meat and dairy itself is acidic, and that's why it strips the bone of that. So if you're fighting a diagnosis or if you already had these procedures, you need to be mindful of those, your intake. Like I said, take a good food grade supplement. Diatomaceous earth is a wonderful supplement. It is a mineral. Our food used to have vitamins and minerals. And a lot of times when we supplement only vitamins. but we need to supplement our vitamins and our minerals. And diatomaceous earth is a great way to get that mineral in. You can get it in a bag of it off of Amazon. You only need like a tablespoon of it a day. It doesn't dissolve, so I put it in like applesauce or my smoothies or um, my oatmeal. But it is great for bone loss and it fixes a lot of deficiencies, which in turn fixes a lot of diagnoses. So if you look up diatomaceous earth and high blood pressure, diatomaceous earth and cholesterol, you're going to see a lot of people saying that it helped, but it's because it fixed deficiencies. Of course, with lifestyle and diet change. Vitex is the woman's herb. So it's good for menopausal symptoms. If you still have your ovaries, it's be good for support. But Vitex is literally the woman's herb. Vitamin B complex is good for your brain waves. So the depression and mood side of it. And they already have complex, supplements already made. So you can even type in mood supplements. They have it already together, but those herbs will really help support those brain waves and just help you feel better. The coenzyme 10 increases the oxygen to the heart. So we saw that if you had a hysterectomy, we saw a lot of heart stuff going on. So that means that's why you got to keep that weight off. That's why you got to have a good diet. And we need to feed our bodies that proper nutrition so our hearts can function properly. Get regular exercise. Like I said, everybody know I'm a personal trainer. It don't have to be me. You go out there and walk, right? Play with the kids, whatever it is, you need to move, you need to exercise, you need to be healthy. And so, yes, regular exercise. You can use vitamin E or aloe vera gel to lubricate for painful sex, since a hysterectomy can lead to a dry vagina. Some natural estrogen promoting herbs: anise, black cohosh, fennel, red raspberry, wild yam root. Estrogen rich foods: flaxseed, soy, dried fruits, sesame seeds, garlic, peaches, berries, wheat bran. Feed your body what it needs. Thyroid. We saw that if you had a hysterectomy, you will probably need some extra thyroid support. They have blends for that. Find your blends and make sure you're giving your body the support that it needs. And at the end of the day, all of the research said that reversals would possibly be the best option for some of these things. If you did the tubal ligation or if you did the vasectomy, getting those reversed would be kind of your best options. So that was kind of what I wanted to share about vasectomies, tubal ligations, hysterectomies. Um, you can find me on Facebook, Latoya Castro, or Earthside Harmony, Instagram, Fit Locomoca, or you can email me at earthsideharmony@gmail.com. But since you all did not see those first slides, I did just want to kind of fly by the vasectomy ones just so they would be in the presentation. But if you have any questions or comments, you can go ahead and cut your mic off and ask those. I just want these slides to be in the presentation. Or any experiences. Like, I feel like we go through a lot of things and we don't even, some of them don't even verbalize their experiences. And I learned that in the birth world. We really feel like we go through a lot of things alone and we don't. This is a problem. This is a serious problem. And that's why I really wanted women to be able to maybe identify some of the things that they're feeling, because I know that you can go to the doctor, to the doctor, to the doctor, and they don't give you an answer. And they sit here, give you more medication, give you another diagnosis. And that's not what we need. We need to get to the root of the problem. And so that's why I say, even if you have already had these procedures, you need to know that, for example, depression is a risk of a hysterectomy. Or just the hormonal changes. so that you know that it's not just you feeling like that. Um, we need to know how what we're putting in our mouths affects our body. The food that we're eating is a lot of times directly linked with what we have going on in our body. So I just kind of wanted us to kind of make some connections, make some informed decisions, get the information out there. Like I said, even if it's not something that you are considering, if you out in the streets and you hear people talking about it, then you know information and facts to tell them of why they shouldn't do this, or if they do choose to do this, what they need to do to kind of counteract some of these things that they could be walking themselves into. So does anybody have any questions? Let me look in the chat. Somebody said it looks like they rebranded symptoms of menopause, PTLS, or is it possible tubals can send women into early menopause? And we really need to understand it, because I know that I have friends and loved ones that have definitely gone through these symptoms that I have seen in these studies. And so I can honestly say, when I look at the pros and the cons of what is said versus what I actually see, it lines up more so with what I actually see in my friends, and these studies line up with what I see. And so I definitely just want us to be proactive, make informed decisions. I appreciate your attention. Oh, let me put these links in the chat, like I said, for the presentation. And I will upload the video in the event page, on the event page. So I made a handout with all of the suggestions that I have mentioned in the presentation. And everybody knows that they can always reach out to me, of course, if they need something. I'm available for, I love talking anything health. I want us to be alive in these streets. So I'll put in the chat, and I'll put it also on the event page, the presentation and the solutions handout. And I appreciate your attention. I'll see you at the next time. We're going to talk about the next topic. Um, it's going to be a good one. It's going to be a good one. So thank you for your attention. I'll see you next time.
Thank you.